Jim Joyce, so great to have you on time this time.
I'm here, man. I'm here.
And I'm glad I didn't lose my co-host as much as I loved having Alyssa on, and we kind of kicked it off. We had good energy, I think, but we'll let her judge it. But you're irreplaceable.
Yeah, I thought you guys are good. I'm fine with that. If that's the next relationship, if that's the next relationship where you're going.
I even with the DTX podcast, I felt like I'm cheating on you, right? So well, I think I'd like to stick with you. No offense, Alyssa. Enjoyed everything. In the news, I just came across even though it's just like crazy, but our friend Eddie Martucci, Achille, going public through a SPAC.
Yeah, through a SPAC. That's unbelievable.
1B, right? Another unicorn, DTX space, blowing up in a positive way so far.
That feels kind of, it feels nice, and it's kind of, it also, maybe it's like post all the fervor, it feels like even the whole SPAC environment was obviously quite exciting, and there's lots of activities, and it was almost hard to understand. But this is like, there's been less recently, right? Like it's kind of, there's a little bit of temperament in the market.
Yeah, I mean, look, let's face it, and love Eddie, I love what they're doing. We've seen some of the both IPOs and the SPACs, right? Kind of, and with the whole market honestly decline. So this is a bit of a ballsy move, but congrats to the team. I think they've been public. Yeah. Oh wait. Oh yeah. Anyway, I honestly keep forgetting
that I'm public. Yeah, the IPO. Steve Seuntjens sent it over that HealthBeacon was one of the top 5 global IPOs per CB Insights. Right.
That's right. That's right. Congrats. Yeah. That's right.
But I love the fact that when they're going and looking at like Irish IPOs, and we were the only one, the only Irish IPO. But hey, listen.
Well, so congrats on both being the only one and in CB Insights. That's awesome. That's right. I just remembered that, so I'm sure you're tracking it. So our guest comes from pharma industry or constantly around it, but let's let Mr. Paul Sims into this.
I'm excited.
Room. Are you excited to meet Paul Sims?
Totally. He's a legend in the pharma industry.
Who isn't excited to see Paul Sims? Just going to switch my cameras. There we go. How you doing, guys?
Good. Hey, Paul. Jim, Paul.
Pleasure.
Good to meet you. I feel like I know you pretty well already, though, Jim.
Yeah, your reputation precedes you.
Which is normally what people say to me, and I have the worst memory ever. So I'm constantly like, you are embarrassing myself.
You've got a great, I always kind of reflect on people's names. You've got a great name. You know what I mean? Like Paul Sims, it's very, it gets kind of, it's
not as good as Jim Joyce, but I'll take it. I mean, it's way better than Eugene Borukhovich.
I was going to say, it took me like 30 years to figure out how to spell it myself, right? So no expectation otherwise.
That's a low bar.
So Jim, a little background for you. The way I still remember this, the way I met Paul through just Federer, as I was coming into Bayer at the time, and this was my first real pharma gig, right? I've been around health tech and PBM, right, but not inside pharma. And just introduced me, like, you got to meet this awesome guy, I for pharma, #trust pharma, and I was like, who says trust? Like anybody who says trust something, like, whatever. And I remember, Paul, I gave you crap on that first call for that alone. And then we just kind of got along and kept in touch and all of that. So that's just the background.
And it could only get better from there, right?
Yeah, exactly.
How Eugene makes relationships, right? He starts off like to say.
Yeah, I'm pretty sure that's the best way to make friends.
It's the Eastern European style. It's the Eastern European style.
And we're not going to let you talk, Paul. We're not going to let you talk yet. But like, where are you calling in from? Just before you.
I am from sunny London in England, so yeah,
okay.
Good.
Okay.
Obviously,
Excellent.
apart from the sunny part, yeah.
So tell our millions of listeners and viewers kind of a little bit of your background, and we'll interrupt as we go along. But kind of through your personal, professional, however you want to cut it, and then we'll sidetrack you, of course, as always.
Sounds like a plan. Like so many of us, I think I came into this industry by accident. I think my true calling was probably something in like the kind of design and architecture world. I was a weird teenager. I've subscribed to some kind of design or architecture magazine since the age of 11, I think. So definitely that was my true calling. But like so many of us, I think we fall into this industry. For me, it was like joining a company that did events in every industry, and they just kind of said, there's a space over there in the pharma team, go and sit over there. And then you realize the incredible unfulfilled potential that we have in our industry. Obviously, it provides more stable careers, perhaps, in the average industry as well. But I think that I would never want to leave it now, actually. I think there's just so much damn work to do. We are so much worse than what we could be, our industry, as well as the specific things that we're working on. No slight on anyone. It's just we've got a long road to travel. I think of us as an immature industry, not a mature one. That's for sure. I can talk about that if you like. But I ran this thing, i4Pharma, for 17 years, which was honestly the wrong business for me. It's very operational. It was very, very.
And it took you 17 years to figure that out?
Yeah, I'm also a wimp. I should have left probably sooner than I did. But yeah, what it did do, of course, was it meant that I came into contact with everybody in the industry, and I was able to build up a pretty good set of friends, I would say, in the industry. I guess for all that time, I've been hunting out the people that I gel with most, which are, ironically, despite his first message to me, the people like Eugene, who are here to kind of change the status quo because they're dissatisfied with it. And that's obviously who I count as my friends today. But, for 17 years, I felt like I was a talker, and I wanted to be a doer. As I say, I'm an introvert. I wanted to build things. And I just felt, okay, talking about the future of the industry, I need to get my hands dirty. So we were acquired by Reuters, which was a nice pat on the head, but gave me the chance. I'm not very good at working for huge companies either. It gave me a chance to get out of the way, and just this thing, I don't know if you heard about it, called COVID came along at the same time. So that definitely made it an easier choice to get out of running large events as well. And since then, I've just been able to do what I call freedom, which is to work on really interesting ways of bringing patient value with really cool people on specific projects all over the place. And it's been exactly the journey I wanted. So that's where I am.
And is
today.
that inpatient health?
That's
it.
Health.
Okay.
Exactly right.
Okay. Nice background.
So it's a great background. Is it a consultancy, or is it a platform, or what?
Yeah, I try to be a sort of an unconsultancy as much as possible, but yeah, it's a consultancy mixed with a think tank, I would say, because we are very much just as interested in rethinking as opposed to just redoing. And I spend a lot of my time, as you may have seen, trying to be annoying, which I think I'm actually being quite successful at publicly, and provoking our industry into doing things differently. So, yeah.
I was gonna say not annoying. Yeah, I think you self-describe as a provocateur, and I agree. I mean, you do ask the tough questions, and you actually get responses, which is fantastic. And Jim, I don't know if you know this. I know I've kind of dropped the ball on it. I thought I was so brave. I started writing that book with the updates, hard pill to swallow. And then Paul was usually one of the first to respond to my weekly, chatter. And so I actually incorporated quite a lot of his responses in the following. And then I didn't quit. I paused, Paul, so I'll be back. But actually,
much of us, everyone in life has an unfinished book, Eugene. Anyway.
Yeah, exactly.
I was thinking as you go ahead.
No.
No, as you were describing your background, I was thinking about my own career in the pharmaceutical industry, where I worked for a long time, kind of grew up through pharma, and, great career, great mentors, learned a ton. And then they gave me the best gift of all, which was a really crap boss in my last time. So that forced me to.
What was the boss's name? Just to be sorry, I'm not here to be the provocateur.
I had beautiful bosses up until then, and great mentors and advisors, and then they go, "Here you go, Jim," and then that forced me to go out my own. Right? That was the gift.
Perfect.
Well, they always say, right? People don't leave companies. People leave bosses, right? That's kind of the statement. I don't know if that's how true or not, but Paul, at some point you were also, I think, writing a book, and I loved the name. I don't know if it's trademark or not. Can I say it? I love the name.
Yeah, you can say it. You'll be the first one in many a year to say it.
Pharmageddon. Like, what a great name.
Very good, very clever.
Virtual trademark by Paul. But I mean, what was like the thinking? And I know you and I chatted about this. I actually remember when I was leaving there. I think that's when the first time you mentioned it to me. But tell us a little bit about what you were trying to do there.
I was trying to extrapolate where we as an industry wanted to go. And I kind of organized the chapters according to things like invincibility and immorality. No, not immorality, that's the wrong one. But, a few words of that kind of omnipotence and things like that, because ultimately, things like the life extension movement, the preventative care and all the rest of it were ultimately taking us to these destinations. And I just wanted to I find that this is not your case, Eugene, but I found that in an industry that we constantly berate for its slow pace of change, there's no carrot at the end of the stick. There's no pot of gold at the end of the rainbow. What are we all actually trying to get to? And I wanted to paint a picture of what the world could look like. I actually wanted to make the book half fiction, half fact, making a fictional story of life in the future and the factual, how the hell do we get there? And split each chapter into two halves for that in that way. And then I got to the final chapter, which was very much about business models. And I actually found myself being really inspired by rethinking. I was inspired by big tech, believe it or not, which almost sounds like a swear word nowadays. Back then, when I was writing this thing like 4 or 5 years ago, it was seen as nirvana. But I observed how most big tech companies are effectively platform companies. The classic story is Uber doesn't own the cars, it connects drivers and passengers. Airbnb doesn't own the houses, it connects homeowners with visitors. I was trying to basically think, well, why can't we create a pharma organization that doesn't own drugs? Why can't we create a sort of development platform or a commercialization platform which brings together the drug owners, which typically are academics or biotechs in their early days, with ultimately patients and HCPs and the users of those things, and act as a sort of development partner to get that kind of thing going, and work at risk. Like the Apple App Store doesn't charge money to an app maker up front. It takes a share of revenue, some would argue slightly too much. But the point is that all of the solution providers and service providers in our industry take an upfront fee. And they also have misaligned objectives. Any person who's worked extensively in clinical trials will tell you that a CRO is working for fees, not to share in the success of an approved product. Right. So my idea was that by aligning this and having an at-risk model, you could actually get all of the support you needed in a far smarter way. You could also, effectively buy in several drugs in a same therapy area and hence have a lot more shots on goal for the same amount of efforts or the same patient population. And you could do a kind of Elon Musk style order of magnitude improvement on the development process as a result. That was the dream. Unfortunately, I don't have $1 trillion to make this a reality, but definitely I almost forgot about the book when I discovered the book took me to this model, and I became far more interested in actually, let's making this a reality instead of.
I think like Forest Labs, didn't they try to do a version of that? Like that was kind of, like they refused to have an R&D department, yet they built up this, but they
I
didn't go as far.
don't know that story, Jim. I should probably look into it. But I mean, I know the company, but I don't know the story.
Yeah, like, you know, classic pharma model, but they didn't go as far as what you're talking about. Like, you know, I think you're talking about something, you know, and then they kind of classically move into the squeeze on the negotiation. Like it's like, I think that's always like, you know, like the way with medical devices where the original innovators get a very small fraction of the ultimate share, right? Like it's
well, yeah, you kind of have to sell out in many ways, don't you? I mean, what is the route? Unless you have the best product ever, you have to sell out to a larger organization. We obviously see that in the areas you guys are working in with digital therapeutics in so many cases, although we do see some brave companies trying to take it the whole way through, which is fantastic. But yeah, I just think people have a really bad choice. Innovators don't get to see their therapy through to the end in most cases. In many cases, they don't want to, but that's partly because the whole structure, you know, VCs don't expect to stay on board beyond phase 2. Right. So, I want to totally rethink the way in which drug companies can be financed as a result of not having to pay all these upfront fees.
I mean, look, you know, I think let's take the risk sharing, which I think is a key component of that model, right? I mean, I do think that many pharma companies, right, lots of kind of open innovation, you know, in-sourcing, in-licensing, you know, R&D departments are shrinking, right? And then on the other side, it's the market access, right? And I think we do need to kind of fix that in the middle and the risk sharing component. But in a way, that's what you described, minus the risk sharing, is sort of happening in the marketplace already, right? I mean, or starting to slowly. But
also the financing of that, like I think is really interesting. Like you know, to talk about my own company, but like us going public on the Euronext Dublin. There was this, you know, people would ask, why would you do that? Well, it's because it's kind of long-term access to capital. So the way the structure works is that if you know, actually Alyssa said that last week on the podcast from 7wire. She's like, you know, a good outcome for someone who owns 70% of a company would be sell it for $20 million US, right? And that's a ton of money, and it's kind of transforming.
That's not enough.
But yeah, for the VC, it's not enough. So the model is set up that you're basically getting 3 to 5 year capital that has an expectation of a 300% return, you know, and in order to be seen as successful, you know, so that's expensive capital, and that's, you know, pretty fast payback.
It's expensive and very impatient capital for that obvious reason. But imagine you didn't have to raise all of that money. Imagine you could see it through. Imagine, you know, you could lose a smaller proportion. You might lose 20 or 30% of sales, but not have to pay nearly as much upfront for that actual development process. I think that could be a very attractive solution, particularly for people who have that kind of patient orientation as the reason why that they founded their companies in the first place, which is a lot of people. Right. Often, you know, responding to, you know, personal stories or issues they've had, and that's why they've created their companies. And I just think that to be able to provide that third way would be really, really attractive.
100%.
Paul, you, as we've been talking, right, like you're a kind of guy I also think like loves serendipity, and I'm going to actually rewind back. When I was at Bayer, I started implemented this like serendipity calls, right, where I have like a 20-minute slot, you know, a LinkedIn connection comes in, I pretty much kind of like respond. And I saw you did something the other day, which like you just got bombarded, right, with your calendar entries. I'm super curious because I've been fascinated. I mean, I had to squeeze time now that running your coach, right, but with Marina, to like 2 hours a week max on these serendipity calls. But like, tell us and the listeners, viewers, like what you've learned. What was that experience like? And a little bit of the process.
I think you're a smarter man than I. I was not expecting a response. So just in case people haven't seen, I literally just posted on LinkedIn on a Sunday in January. Here's my Calendly time. If anybody's having a struggling time or just want to chat about anything, book a slot. Here you go. And I just made my entire calendar available.
Wow.
And I thought like on a Sunday afternoon, I'd get like 10 hits. So just to put it in perspective, I have more than 100 meetings this week.
Wow.
as a result of doing this.
Wow.
So yeah, the fact I'm actually here, guys, you know, I hope you're honored because. You know.
Well, that's awesome.
I should have booked you on your Calendly. That's what it should have done.
Yeah, but then you'd only get 15 minutes, and
Actually, I want to ask you. Actually, I could ask both of you guys this question. So, like, how do you what's your coping skills? Like, I'm just thinking about I would have gone to your lovely conference that you would have run. I for Pharma, and you're up on stage, and you have that kind of on stage. Now you're kind of famous in front of everyone, and then people come at you, right? Like, and I know Eugene does a lot of emceeing at events. And like, how do you cope with that whole kind of asynchronous, or people have, they have a lot of information about you, but you don't know who they are. Like, what's your coping mechanism?
Well, I don't think I'm quite at the A-lister stage yet, where I swagger around thinking, "Who are you, little person? What are you doing talking to me?" There's definitely, and I have, as I said at the beginning, a terrible memory. So I often find myself like in that situation where they do know lots about me, and we may have even had a conversation before, and I've forgotten the person I'm talking to. It happens almost daily, I would say.
I think, Jim, you're also that way, I think.
Oh, yeah. Totally.
Yeah.
Like what I'm your dad.
The calls that I felt least excited about because they had the least utility to me. So, a sort of 17-year-old looking for career advice. The ones where I kind of went, "Oh, okay, I'm just going to do this. Just going to struggle through it."
Right.
They've actually been the ones that I've enjoyed and even got the most out of.
Wow.
It's, and that surprised me because it's been so endearing. I find actually generally people in our industry are fantastic one-to-one. It's when they get together that the groupthink and the sort of safety first mentality takes over, and people becoming lemmings and don't want to take a risk on a one-to-one basis. And I found this generally, not just recently, but always, that people are pretty smart and ambitious and bold and creative and thoughtful and all of the things that you would want them to be, even when they're only 17 years old. And it's just been fantastic, actually. As a natural introvert, I'm wondering why the hell I did what I did, but I'm actually really, really enjoying it. Despite the sort of fatigue of it all,
Wow.
I've got so much out of it from, yes, a sort of business point of view, but also from just a personal point of view. And there's been a lot of teary moments, people crying on each other's shoulders, and from people that would ordinarily you'd think of as a someone to look up to, and they're having some vulnerable moments and stuff, and then great ideas. Lots of people from India, interestingly, who I don't normally interface with. There's probably been 20 or 30% of my calls from India, and what an entrepreneurial country, doing so many amazing things. Genuinely have huge respect for some of the stuff I've seen. So totally didn't know what to expect. Did it on a whim. Totally upset my team by destroying my entire calendar, and they can't get in touch with me for love and money now. Totally killed my own health. Lunch is now a chocolate bar if I'm lucky. But it's actually been worthwhile. I probably won't do it for the whole of January next year.
Are you doing it for the whole of January?
Well, it was the first weekend of the year, so I think a few days had passed, but it's over 3 and a bit weeks.
What's a 17-year-old looking to get into the pharmaceutical industry? Like, what shocked you about their perspective?
Just how damn smart they are and how much they know about what's what, and like they're calling on me for advice, obviously, and I'm kind of being wowed by their assessment and breakdown of what's happening in biotech and the market dynamics, and I'm like, geez, man, this conversation should be the other way around here. I'm the one that's learning.
But look, we all and this was my premise always for the serendipity calls, like everybody has a story, right? Like, we're all humans, we all come from somewhere, right? And everybody has a story. And I'm also very much of a big believer in like reverse mentorship. Like, you learn from others that are not like you, that are younger, older, same, different profession, right? Like, and it's just curiosity, right? So if you're a curious person, like, to me, these conversations, I don't know if I can do the 100 that you did. Like, that's insane to me, because it's like, I would almost like automate the beginning, which, by the way, like now when I jump on, I'm like, okay, 30 seconds about me, give me 30 seconds about you. Like, everything is kind of like the 20 minutes is now very much like, how can I help? And actually the same shit that I did to you, Paul, right? Like, I for Pharma, trust Pharma. So like if I'm sensing, like I'm like, listen, I am very much straight up like this, which she's what you get, you know.
Right.
We only got 20 minutes. And you know, some people enjoy my directness and some will probably never talk to me again, right? So
well, that's okay. You probably don't have time to talk to them all again anyway.
no.
And well, I think people must be learning a lot from you. Eugene, you've had incredible experiences. I'm sure you know that. And to keep it consistently going, like it sounds like you're doing, you're still squeezing it in. Shows that it's got some value, but also it's a measure of your character as well. I think you should pat yourself on the back for that. So they say time is the most precious gift, and that's what you give it.
It really is. So where, you know, I mean, Jim, I don't know, I've been like occupying Paul with my questions. If you got some, I got plenty. I can keep going.
Well, yeah, no, I don't want to interrupt you. I think, so trust, like, so I've seen you speak a lot on trust, like within the pharma industry, and you were, I was just looking up, you were interviewing these different CEOs, and and you said, okay, one described trust in one way and one described trust in another way. So like, what's your take on that, and maybe just dig into that first?
Yeah, sure. It's actually been a while since I talked about those kind of interviews, but I think we can do trust in our personal lives. I don't know about you, but I don't feel like I have to check my partner's phone every 5 minutes to be able to trust her, right? I don't feel like transparency, which is what we seem to boil trust down to in our industry, is the sole facet of trust. That if you're creating a relationship in your life, that's not the only thing. For some reason, when we get into our professional bodies, again, we kind of fail to sort of take our humanity forward. Like, we have to act as human beings and not these faceless corporations. I was actually quite pleased by the initial communications response by our industry when the first COVID vaccines came out. I thought Pfizer, for example, did a very fine job in socializing the communication. And I was saying at the time, I think that the vaccine take-up, which was considered high in those first few months, was so good because of the such human approach that they took to communicating around it. And I actually made, I don't know if you've seen, I do a lot of predictions because I think they're a good way of starting great conversations in our industry. And I predicted that we would see a new approach to communications coming in our industry as a result of the success story at that time. I would have to say we have failed to follow through since then. And I think that we go back to the sort of safety first mindset, never telling anybody about anything that hasn't already happened and hasn't already been checked in 1,000 different ways. That, when you think about, how Steve Jobs or today's Elon Musk or anybody that would consider anybody inspiring, remember that shareholders need to be inspired as well. We live in an industry that should be the most inspiring of all. If Elon Musk can get a whole group of people excited about battery technology, then we should damn well be able to do it about health. For crying out loud, like, why not talk about the future possibilities a little bit more, and inspire people to take people towards, join us on a journey to making that a better place. I suppose we're going a little bit back to what I was thinking about with my book as well. The whole trust thing is just so much more multi-dimensional than we're thinking. Yet we know the answer already. We just have to look at ourselves and our own personal lives.
Right. Like if you think about like that, like the idea of like trusting a company and, or they being transparent, right? Like you said, like if I remember I was thinking of my father got COVID in Florida early on, and we were all nervous about it. And each of my sisters would call him and check in on him, and he would give a different answer depending on which family member called them. So he would say of what he was doing. So it would be like, he kind of trusted me as a son. So I was closer to him, and he would be like, hey, here's what's really going on. And then to one of my sisters that would scold him all the time, he would give a different response. And then they would say, oh, we can't trust Dad. I'm like, no, you can trust Dad exactly to do what Dad's going to do. Like, he's going to give an answer tomorrow. Like, he's going to give to one sister like that, to me like that. We could completely.
And that's what sort of intimacy and trust is about. It's not about perfection. It's about, you can even change your story like you've just described. You can even be ingenuine and still trusted.
Yeah.
And I think that's a lesson we have to learn. I mean, Gen Z is about to take over our industry. You know, people in Gen Z are now 24-year-olds are entering the world as physicians, they're entering the world as patients, they're entering the world as trusted members of our pharma life sciences community, whatever you want to call it. And this is a group that is the least trusting of all, and is historically the least brand centric of any generation before. Oh. Any loyalty is generated through actions rather than words. People can see through stuff. There's 1,000 message boards to discover the truth behind any claim. And even they've started, you know, through the meme stock phenomenon of last year, they've started to control the future of our company's value. And I think that our industry could be treading in a very dangerous place if we don't serve and observe this new generation much better than we have doing, because they're getting organized. And the next opioid crisis, we may not be able to survive collectively as well as we have.
Wow. You know,
so,
I mean,
we need to sort it out.
Yeah, I had to process all that. But you know, I think to your point, you know, trust is earned, right? And even if you're the least, and that's where kind of honesty as well, right? That's a key component of building that trust. And you know, yeah, wow, that was deep. You got me like really thinking now, Paul.
Well, it's deep to us. Unfortunately, we're getting a little older, unfortunately, and it's not deep to one of the 17-year-olds that I was talking to at all. It's natural. They don't remember a world without smartphones, and they don't remember a world where you trusted brands, because why would you?
If you think about the
speak for yourself getting older, by the way. I don't know. Marina says I'm a 12-year-old kid.
You're actually,
yeah.
I was thinking about you. I thought you were saying before you were going to go into, you know, like I think about like where the pharmaceutical industry is going, and, you know, just the power of discoveries, you know, the idea that we'll be living with, you know, like cancer that I think touches all of us. You know, the idea that becomes a chronic, you know, for certain of the conditions that within our lifetime, we'll see that become a chronic treatment versus a, you know, a sentence, and you know, this idea that you could kind of completely transform your health. Like I was just in Orlando last week, and we were staying near Orlando Health, and it must have been a place for like amputees or something. There must have been a facility there, and they were in the way. There were people that had amputations, and they were walking through the lobby of the hotel, and their gait and everything was just fascinating. You know, it was like, wow. Meaning like somehow the mechanical aspects of the machines they were using, you know, the prosthetics was off the hook, because, you know, it looked like they could go play a game of basketball with you or something. You know, it was just amazing, you know. And so you think about what's going to happen molecularly with medicine.
Well, and let's
to that apart from fucking hell.
I want to be able to dunk a basketball. You know, that's my goal. Like I want to.
Well, I'm actually like 9 foot tall. Zoom is the great leveler, so I'll just pop it in.
So, Paul, I know, you know, you've spent quite a lot of time, as you mentioned, 17 years, kind of working with Pharma and Plus, but mainly on the molecular side. This is, you know, the shout of digital health therapy. What are your thoughts around, you know, this, you know, now buzzword of digital health and digital therapies and et cetera, as it comes to pharma? And, you know, is pharma ready? What's your observations?
Pharma will never be ready, which is why we have to force it upon pharma in many ways, much like, by the way, other molecular areas like psychedelics, cannabis, you know, all of anything that you would describe as new. And long may that continue. I'm energized by the efforts of companies like yours and everyone else's to bring this to life, to change regulations, to bring it into the portfolios of companies, to, you know, absorb the many failures and the iterations that need to be created, and to find ways in which it needs to be done. There is obviously a huge amount of inevitability around the use of digital health. I talked about Gen Z a second ago. You know, this is a generation who considers a physical form of communication to be a giant hassle. And you do too, by the way. I bet you prefer your banking app on your phone to having to go into a real bank. Just unfortunately, we haven't created such convenient solutions in the healthcare side as yet. But of course, it's an uphill struggle. And of course, it's painfully long and slow and frustrating that so few countries still have actually created a clear pathway to the market. Yeah. But all I say is anything I can do to keep encouraging and keep supporting and keep pushing and support, everyone collectively, I will do so, because it absolutely needs to happen. I would obviously just love to see the mainstream pharma be a little bit more open-minded. I've started to think that we need to have what I call a 5D mindset. Put on your 5D glasses, which is drugs, diagnostics, devices, digital therapeutics, and of course data, and to consider all of that as your product portfolio, not just one component of it, and bring in as partners the components that you don't feel like you can absorb yourself, and deliver a proper wholesome value proposition to your patient, who obviously doesn't see the split according to the way you do. So come
I love
together.
this 5D thing.
Awesome.
Yeah.
Drug, device, data, DTX, and what was
diagnostics,
diagnostics.
DCX, and well, you could. The fifth one is a little weird one, which is obviously data, which obviously flows horizontally more than vertically. But
we'll give it.
I actually think it's not a stupid idea to consider data to be a product as well. We could obviously talk about that for a while, but that is not a stupid way of thinking about your portfolio.
Yeah. And when you think of because I've seen you obviously have had an interaction with the top of the pharmaceutical industry, but not, CEOs, where are their heads? I would think with this is are any of them at a place where they see this as major strategic, moves that they need to spend time on? Does it get any attention in the boardroom?
It does actually. Well, this is it. I mean, I got asked in one of my calls today, is the industry really changing? And I have to say, for most of the pandemic so far, I would say no, disappointingly. Apart from those on the COVID front line, the 99% of us are using that 1% as a bit of a heat shield. But actually, in recent months, I've been quite pleased to see that we're finally getting our legs untangled and figuring out how to walk, if not run. And there are companies, particularly kind of single portfolio area companies like sort of Novo Nordisk's of the world, that are taking the kind of approach that I'm talking about, and who are genuinely trying to make that full portfolio reimbursable. What I'm trying to illustrate here is that these are not just complementary or sort of freebie additions to the drug, or companion diagnostics and things like that, which I almost see as a sort of a lower form of what I'm talking about. But actually trying to make a full portfolio reimbursable, I think, is, put it this way, the patients will vote with their feet, and I think that we're going to have to move in that way. I work with a few companies that are thinking very differently about particularly chronic disease areas in this way, and we're not there yet. I'm not waving the flag. But I am pleased by the green shoots I'm seeing now, genuinely. At the senior level, yeah, a lot of CEOs are just obsessed with drug deals and can't see beyond that. From what I can tell, when I have a sort of really honest one-to-one, no one watching conversation with them, but a lot are trying to do a lot more.
Right.
I mean, listen, that's what Wall Street is asking, right? They're not asking, do you have this new DTX that may bring you 5 million per year, right? They're just not being asked that question. So,
but I would also like to think that the age of shareholder power is not diminishing, but it's, we criticize our politicians for having such short-termist views because they're going to leave within 4 or 5 years, depending on the country they're in. And we often criticize people in our various pharma roles for exactly the same thing. But I really think that having that long-term view now, particularly going along the same lines that we've discussed already in this conversation, trust, building a reputation amongst the customers, looking at the kind of idolatry of the entrepreneurs who do have a long-term view of the sort of names I've already mentioned on this call, they can make pretty interesting things happen. And we should inspire people, as I've said, about the long-term future of healthcare.
Love it.
Awesome.
Jim, I think it's time for your, wrap-up question.
So
Sounds
imagine.
nice, huh? Maybe not for the listeners.
Right. So it's like torture them, we're dripping water on them.
I'm waiting for this moment. Come on, when are we getting to?
Yeah, Eugene largely do this for ourselves. You and I, we do it for ourselves largely.
Totally.
And by the way, yes, viewers, it is as unstructured as they say it is. My preparation for this was a 1-minute voice note from Eugene. That was
it. You got
basically
the voice
I
note.
said we're gonna just talk, just shoot the shit. Yeah.
You probably copied and pasted it from a previous voice note. I don't know.
All right. So picture yourself. You're advising. So you're at a massive pharma conference, and a young, 7 foot tall entrepreneur comes running up to you and says, I've just struck a massive deal with, thanks to your conference, I met some of the top pharmaceutical CEOs, and I've just struck a major deal. And during the conference, I raised a bunch of capital, and I'm flying. And you're looking at that entrepreneur. What advice would you give him?
Retire. No, I'm joking. It sounds like they got it made though, right? What would I do? What would I advise? Interestingly, I've had this question a few times recently. I would say the biggest thing is don't let that sort of curiosity flame die out. I find that this industry has a pretty awful habit of pulling the life out of a lot of people, and that people become indoctrinated as opposed to inspired as they spend their years in our industry. People like you guys have been able to look above that. Well done to you. But so many people, by the way, my life is constantly also like people who are in their 50s and 60s saying, Paul, I'm so sick of pharma bureaucracy. Help me get a job in an exciting biotech or whatever it is. And I'm kind of an informal headhunter in many ways. But we just went through a situation where nobody now has the experience of knowing what the hell is the future going to look like. Embracing uncertainty is the greatest skill now, as opposed to necessarily using your many learned years before you. And I think that we have to embrace the people who are willing to go backwards before they go forwards, who are willing to unlearn because they realize that we need to be on a different mountain from the one that we've been climbing the last few years. And you can't just cross one mountain with a single step, even though when you're as tall as I am, with one single leap. You actually have to go down into the valley, unlearn, be embarrassed, go against the grain, look like an idiot in front of your colleagues. And I often get asked to do presentations, a lot of pharma companies, and they often, again, ask me to be provocative. I give them this slide where I use an example of terrorism that usually frightens everybody in the crowd. And I talk about the story of a terrorist incident in London where this guy managed to stab 2 people. And the amazing part of the story is that he didn't kill any more than he did. And the reason is because some members of the public chased him out of the building where he started this and onto the streets, where he was then shot by police. The interesting thing, he was wearing a suicide vest this whole time. So the people that engaged with him hand-to-hand combat could have been blown up any second. And I tell this story because I ask people, what kind of person are you? Are you truthfully the person that would have engaged in hand-to-hand combat and ignored the advice of your friends and family to stay away and run away? Or would have you been like everybody else? Most of us would be like everybody else. That's absolutely fine. But let's give oxygen and let's listen to the people who are illogical for once, who actually saved the day in that particular example and could save the day again, even if they're talking about unconventional and no concern from their own personal safety. So I would say, don't let that light go out, and make sure that you continue to provoke, as I am. If you don't have to do it publicly, you can do it, internally, but just, don't sort of lose your rough edges. And we need that in our industry. We need more of that, and we don't have enough.
I love
Paul,
it.
That's what I say.
This was mind blowing. Thank you so much for joining us and making room for 45 minutes or so, not just 15, but and to all the listeners and viewers, hit subscribe, pass it on, and see you next week.
Hand-to-hand
It's been a
combat.
pleasure.